Okay, so now that we're finished with the lower, we're going to start the upper. So the first thing we're going to start is we're going to do our buccal, lingual, and central reference lines. So if you want to, you can draw a line right over the peripheral ridge on the buccal and the lingual side. This will tell you exactly where to start your reference lines. You can draw one and two here. This is over the incisal edge of the canines. That's where your buccal reference line will end. So we can draw it right through here. That's our buccal. We start here. This is our lingual. And the central groove of that last tooth will tell us the central reference line. Okay, so let's do the other side now. So lingual, and then this here is our central. Okay, so the next thing we're going to do is we're going to do the buccal cusp tips. And if you like to, you can also do a different color. I would rather you not do any regular pencils because it kind of discolors your white cones. So I would rather do like a blue color. Okay, so let's do these with red. See, it comes like this. They sell them in all different colors. They sell them in red, blue, green. And this one's a regular pencil. So we have to kind of... Okay, is this the red one? No, is this the blue one? Let's see. Yeah. Alright, so now it's time for the cusp tips. The cusp tips on the premolars should be in the center or slightly to the mesial. On the molar, just take a look at the shape of the tooth and try to kind of see where the two lobes end and where they begin, and kind of center the cusp tips on those lobes. And then same thing on the second molar. Now this one is a little bit too lingual, so let's go here and then let's go there. This is where the buccal groove ends. This is where the lobes come together. So kind of center the cusp tip on the lobe itself, on both of them. The lingual cusp tips on the premolars are slightly to the mesial, and on the molars they are slightly towards the distal, and the same for the second molar. Okay, so you have your cusp here and then you have your lobe here. the oblique groove will probably go slightly to the distal, so they will go right between the cusp tips of the lingual lobes. So let's do the contralateral side here, maybe slightly to the mesial. Center these on the lobes, so there should be like an even distribution of space between the premolars and the second molar. A little bit mesial on the lingual cusp tips, a little bit lingual, a little bit mesial, and then a little bit distal on the mesiolingual right here. Center in the lobes, a little bit lingual right here. And if we can notice this, if we connect the dots, we should come up with a rhomboidal shape. Slightly mesial on the buccal and slightly distal on the lingual. So mesial on the buccal, a little bit distal on the lingual. So that'll give us the rhombus shape. Okay, so that is our reference lines and cusp reference points. So let's start with our cones. Alright, so get to put this up on the articulator. And we'll start on our cones. Let's sharpen this up a little bit. Okay. So we'll use our white wax here. Get a little more heat on the subject. Okay. What you can do is you can drop a little bit of wax on here first, and then add your cone. Now we will close it and see how our wax is lined up. Alright, so it's a little bit too lingual, so we're going to move it out slightly. And as you notice, this particular model has a lot of space, so our cones are going to be higher. On yours it may be a little bit, the cones might be half as high. On this particular model I cut away a little too much of the tooth, so we ended up with a lot of space. Doesn't really matter for the for this exercise. it's just a little bit more work because you gotta fill up all of this space. So what I'm doing right now is I'm gonna strengthen that cone a little bit. So that it doesn't break so easily. Then as we can see here, I put it a little bit too close to the edge, so we're going to take away a little bit of that wax, and because this area is going to be filled up by blue wax for the tooth contours. So let's bring this in about a 1/2 millimeter or so. And then we're going to straighten it out a little bit and bring this cusp tip more or less straight up. And as you notice, I'm kind of blowing on it, so you can tease the wax up a little bit higher. So if you have a model like this that has a lot of space, you should do that because it's much easier to get that wax up high there. And then kind of thicken it up at the bottom here, like so. This will allow us for a little bit less fragility on these cones. So let's put it back on the model and see our overlap, which is pretty good right now. So let's continue. The second cusp tip. Incidentally, this is our cusp to fossa model. So if the cusp is a little too long, we can always remove a little bit of it. Strengthen it a little bit all the way around on the very bottom there. That's where it's going to break off from, so you may want to heat up the wax a little bit and kind of adhere it well to the model itself. And take away a little bit from the buccal surface, so we have room for later. Let's add a little bit more light on the subject here. Let's see. Okay, so lay down a little bit more wax on here. And this will allow us to attach the wax a little bit easier. So we can do little dots everywhere. This might make things go a little faster. You can take this off for now, and let's see. Just add our buckle cusp tips. These cusp tips are a little bit more arbitrary because they don't really contact anything. So as long as you put it up to the center of the lobes, you should be in pretty good shape. Just don't build them too lingual, because then it will crash into the buccal cusps of the mandibular. So you should be building them more or less straight up. So now just take a look at this third molar here. On yours it might be the second molar. So remember, the curve of P runs from a curve from the anterior teeth to the posterior. So the first premolar should be about the size of the canine. The second premolar could be a tiny bit lower, and then the mesial cusp of the molar should be about the same size as the premolar, the second premolar, and then the second cusp on the distal should be a tiny bit shorter, and then the mesial cusp of the second molar should be about the same size as the distal cusp of the first molar. And then the distal cusp of the second molar should be about the same length as the mesial cusp of the third molar. This will give you a nice transition with a slight curve from the anterior to the posterior. So as we can see, we have these cusp tips a little bit offset from the outside, and now we're going to try it back on the articulator. And as we can see, we have an overjet and a little bit of an overbite. Okay, overjet and overbite. So this will allow us to give us a nice triangular ridge when we get to that part. So the next thing we're going to do is the lingual cusps. Now we have to understand where the lingual cusps go. So on the cusp to fossa model, the lingual cusps will go right in the distal fossas of the mandibular premolars. The mesiobuccal cusp here will go into the central fossa of the first molar. So first molar, first molar. The distal cusp will probably go into the distal fossa. So the mesiolingual cusp will go into the central fossa of the mandibular molar, right here. The distal cusp, distal lingual cusp, will go to the distal fossa or distal marginal ridge. Okay, right here somewhere. On the second molar, mesiolingual cusp. On the second molar, mesiolingual cusp will go into the central fossa of the second molar, right there. And the distal lingual cusp will go somewhere in this area here on the distal fossa of the second molar, right there. Okay. Sometimes that second molar can be arbitrary, because if you make this cusp tip here, it might go like right in between this embrasure, which means you'll never achieve contact. And it could be the same here. Could be the same here on the first molar. It might end up in the interproximal area, in the area of the occlusal embrasure, where it might not contact. Okay, so we will start with the premolars. Again, I'm just going to add a little bit of wax on each of these dots so that we won't have too much of an issue. Attaching the cones. So now we'll start building. So you start with a little cone. And then we're going to check with the bite. So we have to take a look, see where it is pointing to. So right now it's pointing in the right general direction. So let's make it taller. Let's check the second one. Okay. That's going pretty much in the right general direction as well. Remember, do not make them touch. Just be about a millimeter or so, half a millimeter or so away from the opposing tooth. Let's go to the molar. Remember, ideally, the lingual cusps of the maxillary teeth are a little bit taller than the buccal. Okay, so we have to remember that the cusps of the maxillary teeth are a little bit taller than the buccal. The lingual cusps of the maxillary teeth are a little bit taller than the buccal, or at least at the same height. Not to say that they're never shorter, but sometimes they could be shorter, depending on the physiology of the patient. But on an ideal basis, they are a little bit taller. So let's double check the cusp tips. Alright, they're going generally in the correct direction, so they're just a bit short. Okay, so you see how it kind of goes into the fossa, but it's still not touching the opposing tooth. So let's strengthen the bases of these so that they don't break off too easily. Now on the contralateral side, we're going to do this exact same thing, except that that will be our cusped marginal ridge side, So in that case, we're going to make the cusp tips of the premolars go right to the marginal ridge, or both marginal ridges of the mandibular first premolars. See, if you notice this this cusp here, it's pretty tall, so we have to go a little bit even higher than that when we start waxing the cusp ridges, so that we can achieve that ideal occlusal plane. Remember, the lingual cusps allow us to make the curve of Wilson, and as we know, the curve of Wilson is a curve that occurs laterally, going from left to right on the horizontal plane. The curve of Spee occurs on the sagittal plane. In other words, left and right. The horizontal plane is on top and the bottom. Remember the first lecture that we had when we first started the class. Okay, let's check. That cusp is a little bit too lingual, so let's move it a tiny bit more towards the buccal. Maybe a little bit more. Let's see here. It's kind of going a little too lingually. So let's heat this up a little bit. We could probably move this cusp a little bit more distal too. So let's add a little bit here. And let's take the instrument and see if we can push it a little bit like so. And then fuse it back together. Oops, melted it. But at least now we know where we want to put it. So let's take a little bit of it off. And then put a little bit more wax and kind of tilt it a little bit more towards the buccal. Just like that. Let's close it. I'm still not happy with that. Although it's not a major cusp, it probably is not. Sometimes they don't even go into occlusion. probably bring in the mesiolingual cusp a little bit as well. I'm just going to heat it up a little bit. That way we can push it in slightly. Let's add a little bit to the opposite side to make it a bit stronger. Okay, so that is our cusp to fossa side. Okay. Let's double check. We're gonna put the pin in now. The incisal pin. This is just gonna help us check the eccentric movements. So we're gonna go first to the balancing side. Check the balancing side. Make sure that during our excursion nothing gets knocked off. And it doesn't. Generally what you're looking for is for these cusp tips to be moving right between these two cusps right here. And we're pretty much there. Could be a little bit more distal, but we can correct that later if we need to. This area here I came a little bit too far out, so we're gonna end up taking this cusp in a little bit. So let's do that now. Put a little bit more lingual as well. That's where we're gonna need it to be. And why? Because when we go into an excursion, we want this cusp to be traveling straight between those grooves right there. You see? When we go to the balancing side, when we make these cusps, they will be traveling right in between those two cusps on the mandibular molar. And that's what we want to really do with the second molar as well. So we could probably move those cusps a little bit more distal. So what I'm going to do is I'm just going to add a little bit to the distal portion of those cones. And then later I can carve the mesial portion to move those cones a little bit towards the distal. Okay, like this. And then maybe carve away a little bit from the mesial. Like so. And the same thing here. And then this cusp will end up going pretty much between this interproximal embrasure here, this occlusal embrasure. And we can move this a little bit more lingual so that it's not so close to the periphery of that tooth. here. I'm gonna cut away a little bit from here. Smelt it back together. That's a little bit too distal now. We don't want it exactly in the embrasure. Just pretty much close to it. And then we can correct it on the after we remove the model from the articulator. We know just about where we want to be with that cusp, and we want to be a little bit more towards the inside of the tooth, towards the central groove. Okay, and then we're going to make a little space here. So that we have room for the blue wax, for the contouring. Okay, so we have all the cusp tips on the cusp to fossa. Now we're going to go on to the marginal ridge. Okay, so now what we can do is, if we want to figure out exactly let's get a little bit more precise with this side, with the cones. So what we can do is, we know that our buckles should be going through the so now we know that the buckles should be going right through the openings here, either the cusp ridges right between the two teeth, or more or less as close as we can get to the occlusal embrasures. That's where we want to aim for. Usually the premolars, they'll be going in through this little area here of the mandibular premolar, which is the distal slope of the cusp ridge in each premolar. So you could draw lines like we did on the lower, like so, where we want to be with the cusp tips. You see, we have the buccal developmental grooves here. That's where we want the mesial cusps to go through. So, and then the distal cusp should be going through the distal ridge here, the distal groove on the mandibular, and the occlusal embrasure on the second premolar, or the distal slope here on the distal buccal. Okay, right here and right there. So the distal buccal cusp tip should be going through the distal buccal developmental groove, and the distal buccal cusp on the second molar should be going through either the occlusal embrasure of the second molar and the third molar, or the distal cusp bridge of the distal buccal cusp. Okay. Alright, so let's start. So first thing, I'm gonna lay down some wax again, right where our dots are. So let's lay them all down. Now, the first thing we'll have to be thinking about is where we're going to put these cusps. You could do the lingual first or the buccal first, it really doesn't make a difference. Sequentially it might. Like if you do the linguals first, then the buccals won't get in the way when you're doing them. So let's do the linguals first this time. So we're going to start the lingual cusp of the first premolar. Remember, what we're aiming for is the distal, the distal marginal ridge of the mandibular premolar. Okay, so this cusp will be pretty long also, since these teeth have been cut so short. So don't worry about it if yours are not this long. If you notice there, it's a little bit too lingual. Let's see if we can lighten this up a little bit. Okay. So if you can see this, could go a little bit more buccal and a little bit taller. So let's do that. Let's rebuild it. This time a little bit more lingual. you know, it's going a little bit more towards where we need it to go to. Okay. Strengthen this up a little bit, add some wax. Then we'll start on the other one. Let's start this a little bit more lingual. Okay. Okay, that one's going pretty much in the right direction. Okay, it could go a little more lingual. Right now it's going a little too much towards the distal fossa. So let's move this a little bit more distally. Take a little bit of the mesial portion away. Double check the placement. Okay, that's a little better. So this one will go more towards the distal marginal ridge now. Then we're going to mesiolingual cusp. Make sure little dot is facing the correct area. Remember, on both of them, the mesiolingual cusp of the first molar will be going into the central fossa of the lower first molar. Okay, so let's double check it. Okay. Alright, so it's pointing right in the central fossa. See that? Okay. Let's not forget to lock our articulator, because once we start building the actual ridges, it's going to be very, very finicky. So the articulator will need to be locked at all times. Right now it's a little bit less exact, so we can deal with it, but later on when we start building our ridges, if you mess up in one spot, you're gonna end up having a problem. Okay, so let's do distal cusp here. Alright, so let's double check, make sure we're going in the right direction, and as we can see, that's pointing right to where we need it to be. So let's move on to the distal lingual cusp. Okay, so the distal lingual is going right to distal marginal ridge of the first molar. Okay, right there. So now we move on to the mesiolingual cusp of the second molar. Double check that direction, and that one is going right where we need it to go. Just have to make it a little bit longer. Okay, we have one more on the lingual. And that's right in the distal area and closer to the central groove. So the distal lingual cusp is going to be right in the distal fossa of that mandibular molar. Okay, so we have the contact points right here. Distal marginal ridge, distal marginal ridge. Okay. Then we have the central groove. Then we have the distal marginal ridge, and then we have the central groove. And this can be either the distal marginal ridge or the distal fossa there. The central fossa, distal marginal ridge, distal marginal ridge. Okay, so that's our aim points right there. So now we're gonna go and do our buccal cusp tips. Okay, let's flip it around. So where do we need to go through during our excursions is, let's unlock the articulator. So during our excursions we're going to go right in these areas right here. We're gonna go we're going to go right through here. Distal slope of the first premolar, distal slope of the first premolar, central groove here. As you can see, our lines. Okay, so we have, so our buccal cusp tips will go through here. Distal cusp, the first premolar, distal cusp of the second premolar. The mesiobuccal cusp here is going to go through the developmental groove of the first molar. The distobuccal cusp tip is going to go through the distobuccal developmental groove of the first molar. The mesiobuccal cusp tip will go through the central groove of the first molar here, the second molar here. And then the distobuccal cusp tip is going to go right over the distal cusp ridge of the distobuccal cusp of the mandibular molar, and that will be right here. Okay, so it'll slide right through there. If the cusp tip ends up a little distal, then the more distal the cusp tip, the better it is for the clearance of that cusp. So as you can see here, when we go into excursions, that's where our lines end up going. You see? Just follow these lines here. We have one line here, we have one line here, we have one line here. So when we go into our balancing side excursions, those lines will signify where our cusps will go through. Okay, so let's get going on it. Remember to lock the articulators. You can use little tricks sometimes to move these cusps so you don't have to do them over. You can take this off the articulator too, it's a little bit easier, and you can just follow your lines. Remember, these are the buccal cusps, so they're not going to really contact anything, they just have to be placed in the right place. After each one you can put it back on the articulator, and just to make sure that you put them in the right place. So you should have some overjet and some overbite on these. Also the height of them should be appropriate to the curve of spee. So the first cusp tip will be equal in length to the canines, maybe a tiny bit shorter. And the second one will be a tiny bit shorter than that. And the fourth one will match the second premolar. And just keep going on. The distal buccal will be a little bit shorter. Okay, once you put them on, so the distal buccal cusp on the second molar will match the mesiobuccal cusp of the third molar, and then the mesiobuccal cusp of the second molar will match up with the distal buccal cusp of the first molar. That's how you get that nice curve. just strengthen these cones a little bit so they don't break off. So let's put it back on the articulator and analyze it, see if we put them in the right place. And as we can see here, this is the area that we just did. We have a little bit of overjet, and we have a little bit of overbite. And let's see, let's unlock the articulator, let's see where those cusp tips are going through. See, as we're going through there, those cusp tips are going right, sliding past the distal slopes of the first and second premolars. The first molar and the second molar, the cusp tips are riding through more or less the grooves there, or the distal slopes of the first, the mesiobuccal cusps. But either way, we have such an immediate side shift, we have such an immediate rise between the canines that they're immediately discluding those cusp tips. So I don't think we're going to have a problem. The only thing we have to go by is we have to go back and reanalyze the length of these cusps here. These cusps are a little bit short, so we need to lengthen them. Don't make them touch, again, don't make them touch the opposing tooth. Make them like 1 millimeter shorter, because as we are adding the cusp ridges and the other anatomical structures, those will come into contact. Okay, so as we notice here, our lingual cusps are now longer than our buccal cusps, which is what we really need to pay attention to. And there we go. This is our cones. Okay. The next step is going to be the cusp ridges. Okay. There's the other side. Notice this side, the cones are a little bit shorter. And then this side the teeth have been cut off a little more than the other side. So this is it. Now we can start our cones. So this is it. We can start our cusp ridges now.